Today, we'll be looking at one of the vascular supply of the heart, the right coronary artery. The right coronary artery arises from the anterior aortic sinus in the ascending aorta. This is the ascending aorta, and inside it is the anterior aortic sinus from whence it originates. On the surface of the heart, it originates at the junction of the pulmonary trunk and the aorta. It runs along the anterior right atrioventricular groove or the coronary sulcus. Here it gives off atrial branches, small atrial branches, and ventricular branches. It also gives right conus artery at near its origin, which goes around the pulmonary trunk. Finally, on the anterior surface, there are the marginal branches. These marginal branches originate at the inferior border, run along the inferior border up till the apex of the heart. Now, the artery moves and turns around to the posterior aspect, inferior and then the posterior aspect. Here, we can see that the artery terminates by giving off the descending posterior interventricular branch. This supplies the posterior one-third of the interventricular septum. One point to note is that of cardiac dominance. In the descending posterior interventricular artery is in 70% of the people is made by the right coronary artery, as we can see here. However, in a subset of the population, that is 20% of people, it is actually made by the circumflex branch from the left coronary artery. And in even smaller population, that is 10%, both of these arteries contribute to the formation of the posterior interventricular artery.